Brandell. I'm going to be explaining to you how I got my CNA license and how you can do the same. Let's go. The first question I get is when I got my CNA license. I got my CNA license in 2019, in the beginning of 2019, and I took the courses at the end of 2018. The second question I get is why I got my CNA license. I got my CNA license because I was working in the behavioral health field. It was okay. I liked it. I loved it a lot. If they paid good, I would go back. But I was making $11 an hour, 11 and some change an hour. And I was becoming an adult. Like it wasn't, I was 20 or 21, and I started realizing it was time for me to move out. It was time for me to get my own. It was time for me to really be okay with my money. Not recommended. But I did a no call, no show. And that same night, I signed up for a CNA class that was starting the next week. The program was called Entry Level Nursing. It's located in Philadelphia. I'm not sure if they're still open. They may still be open. But I know there are a lot of different programs that offer your CNA license. There's a lot of them. The program itself was a month and a half. And after you test out of the program, you have to pass and get your CNA certificate first. You get your CNA certificate, and then you take your certificate and you go and you test for the boards. I forget what they're called at the moment, but whatever state you're in, it's different in every state. It's called something different in every state. So I tested out in the CNA program, and then I went and I took my boards about a month later. This whole time I was doing Uber Eats, Grubhub, and I wasn't making no money there. You can work in nursing homes. So I personally started working in nursing homes. It was my first job I think I was making 13. It wasn't much of a difference. I was making $13 an hour at this nursing home. And it was like a $1 or $2 differential fee. So I came out with at least like 17, 17. Somewhere around there. You can work in the behavior field. They do hire CNAs. You can work in hospitals. I highly recommend working in a hospital, but you may need to go to a nursing home first for about a year to get some experience. I would suggest getting some experience. If you work in the behavior field, you can go straight to in my personal opinion, you can go straight to a hospital, because it's the nursing homes and in the behavior field, like they're kind of the same. Just one is the nursing home is like a bigger scale. The behavior field, most times you're in a house or at a day program or something like that. But you do like have caretaking experience, and it's all about caretaking. It's all about making sure the patients have what they need, making sure the nurses are good. I suggest working in a hospital because it gives you like a broader view, a broader spectrum. You can work in the ER, you can work in rehab in the hospital, you can be a med-surg tech. You can do a lot of different things. And most of the time, they're not called CNAs anymore. They're either called clinical associates or patient care techs in the hospital specifically. And in the hospital, you have a greater chance of learning more. So the hospital I work at, I just took a phlebotomy class, and now I'm registered to draw blood. Only in the hospital though, but it gives you the knowledge, because if you ever do go to get your RN, they don't teach you how to do phlebotomy in the school. You learn on site. So that's a good skill. How much was the course? And a lot of people always ask me, can you use like financial aid? You don't need financial aid. My course was $1,200. So I put down, I think it was, I put down $500 to start. And then like every 2 weeks while the course was going, it was a certain fee that you had to pay to meet the $1,200. Mine was only $1,200. I saw one that was $1,800, and I think now they may be $2,000, but I'm pretty sure that most of these places have payment plans that you can get on. Getting your CNA license is not hard at all. It is the easiest thing I've done as an adult. The hardest thing is the exam for the state boards, but As long as you pay attention, and I suggest that you practice your hardest. Especially listen to every piece of advice that they give you on doing blood pressure. It's so, once you get it, it's easy. Once you just listen for the heartbeat. Once you get to that course, you'll know what I'm talking about. I hope I was able to answer most of your questions. I hope that it sparked an interest in somebody who's looking to get started in the medical field, because this is a really good position to start. If you're looking to get into the medical field, if you're looking to advance to your LPN, you can definitely do your CNA. You can definitely be a CNA while you're in LPN school. You can be a CNA while you're on your way to get your RN. It's a really good learning experience. You get to know your position and you get to see other positions so that you don't make the mistakes that other people make that are in that position. All right. So my name is Randall. If you have any questions, just leave it there. Until next time, bye.